Hi, my name is Rob, and I'm a police officer.
Thanks for participating in my AIDS PSA, Rob. Can I ask you a few
Sure,
questions?
you can.
Have you ever worried about contracting a blood-borne disease like HIV when responding to a scene?
It's something that's always on my mind. Of course, when you respond to a scene where there may be blood or other bodily fluids present. However, police officers are very well trained in preventing uh, the contraction of blood-borne diseases, and we are supplied with various pieces of equipment and protective gear to help keep us safe.
Great. What procedures are taken to prevent needle sticks?
Well, needle sticks become a concern, particularly with searches of persons and or vehicles or homes. Um, Generally, when you're going to conduct a search of a person, for example, like when they're arrested, generally we will ask them very straightforward, do you have any needles? Do you have any sharp objects, knives, needles, things of that nature? Most people will be honest with us because they know we would find it anyway, and they're also concerned and they don't want us to get stuck. After that, after we ask, assuming they say no or maybe they have more than one needle, we will do a very thorough search, but it's conducted in a controlled fashion, and we do search one area of their body at a time, or I should say the clothing. For example, you start from either head to toe and work your way down their body, and you just go very slow, and you're feeling and always being mindful of that there could be a needle present.
Great. How would you respond to a scene where exposed blood is present?
When there's a known situation where we know for sure that blood is present, or it's you can see it's very a lot of blood on the scene, uh, we always will use like latex or non-latex surgical gloves, sometimes eye protection, or if it's really a lot, then we do have like surgical gowns and things of that nature. Um, and then we will take precautions. We'll watch where we walk because aside from getting blood in on your hands or on your skin or in some type of mucous membrane such as your eyes, your mouth, nose, you also want to be concerned about where you're stepping, because that will, if you get blood or some other fluid on the bottom of your feet, you can bring that into your vehicle. You can bring that back to, say, the police station, or even to your own home after your shift.
What would you do if you were stuck with a needle or contaminated with blood?
There are procedures in place under the Ryan White Act to safeguard first responders, such as police officers and medical professionals, from possible exposures. So, a needle stick or some other type of uh, blood or fluid exposure is covered under that. And what that means is that the law requires the hospital will fill out proper paperwork documenting the exposure, the incident, who the exposed first responder is, as well as the source of the exposure or the person who was bleeding, for example. And we'll bring that paperwork to the hospital, and the emergency room physician will accept it, and they're required to do a brief um, exam or blood test, which they get results back in a very short period of time, sometimes within an hour, and you'll find out whether that person has HIV or not.
Okay. Are there any criminal laws that pertain to HIV?
There are, in particular, there's a law which prohibits someone who knows that they're a carrier of HIV from having committing sexual penetration, which there's various examples of that. But sexual penetration with another person without their consent. So, in other words, if someone knows that they are a carrier of HIV, in order to have sexual relations or sexual intercourse with another person, they have to inform that person of their HIV status and receive affirmative consent from that person.
Okay, Rob, thanks so much. And that is how law enforcement handles the possible contraction of HIV and AIDS.
Thank you.
Bye, y'all.